If you recall back a few weeks ago when we started looking at the ethical issues and dilemmas, I told you we were going to take a funnel approach, going from the very broad of issues for society, then narrowing down to issues for organizations, and then finally really narrowing down to ethical issues for the individuals. This week, we're going to look at ethical issues for individuals that occur at the beginning of life. I recognize that everybody in this course has some degree of background in healthcare, whether your background is in direct patient care or whether your background is in more of an ancillary or management type role. However, I realize that we all enter this course with a different level of understanding of the developmental sequence of human life. For some of you, this may be part of your everyday practice. And for some of you, this may be information that has been buried from your education many years ago. I do think having this foundation, however, is very important as we proceed with the rest of the material for this week. Therefore, I do want to take a little bit of time to discuss the developmental sequence of human life. So for some of you, this may be review. For some of you, this may be new information. So the developmental sequence of human life. Pregnancy. If we're going to talk about human life, we obviously need to talk about pregnancy, how pregnancy is defined. So pregnancy is defined as dated from the first day of a woman's last normal menstrual period. The average pregnancy lasts approximately 280 days, which is approximately 40 weeks or 9 months. Pregnancy can end due to natural causes prior to actually delivering a healthy baby. So when the pregnancy ends due to natural causes prior to the 20th week, it is called a miscarriage or a spontaneous abortion. So this means there is nothing external that we are doing as humans to promote an abortion. It's that the woman's body naturally, for whatever reason, rejects and aborts this baby. So a lot of times we find that we hear the word abortion and we assume that somebody took an action to end the unborn child's life. I want you to know that the term spontaneous abortion is a natural process that the body goes through. That is not an elective decision that somebody makes. If the pregnancy ends after the 20th week, it is considered a preterm delivery. And we're going to talk about at what age would a preterm delivery be viable. But preterm delivery, 20 weeks or later, spontaneous abortion prior to 20 weeks. You're not going to be quizzed on this, but I want you to understand it as you're reading to provide you the context. An induced abortion, as opposed to a spontaneous abortion, therefore, is a purposeful termination of a pregnancy. There are what are called therapeutic induced abortions, and elective. Therapeutic-induced abortions are abortions that are recommended to protect the mother's physical or mental health. So this is basically when the doctor has to say to the mother that carrying the baby is providing a significant risk to her health, and therefore they propose an induced therapeutic abortion. An induced elective abortion is initiated by the personal choice and autonomy of the mother, the woman carrying the baby. There's not a therapeutic reason for her health, but it's a personal choice. The developmental sequence of human life is broken into 3 trimesters. So the first trimester begins when the fertilized egg implants into the woman's uterus. During the first trimester, you tend to notice electrical activity from the unborn baby's nervous system at about 6 weeks. A fetal heartbeat, which is very important to a lot of people when they're determining when does life start. Some people use electrical activity, some people use implantation, and some people use the fetal heartbeat. The fetal heartbeat is usually able to be found and heard between 9 and 12 weeks. The second trimester is a period of growth and maturation of the unborn child's body systems. So between 13 and 25 weeks is about the time that the mother starts to perceive the movement of her unborn child, which means the mother can feel this unborn child moving inside of her. At 23 weeks is when the child develops air sacs in their lungs. And for a lot of people, the age of viability is around 23, 24 weeks because those air sacs are so necessary for the child to be able to therefore breathe and live outside of the womb. The third trimester is where the final stages of growth occur. The higher brain activity is developed around 24 weeks. So 23, 24 weeks, as I said, tends to be what is deemed the age of viability. By 27 weeks, the brain of the unborn child is very well organized, and it's getting closer to what the brain of a full-term delivered infant would be. By the time the unborn child is 32 weeks gestation, the brain is equivalent to that of a full-term baby. So generally, the doctors will say that if a woman can carry a baby to 32 weeks, the baby has a very high chance of viability because their organs have been developed to the degree necessary to safely live outside of the mother's womb. We're now going to move forward to talk about the ontological status of the unborn. Or in other words, we're going to talk about when does this unborn become a human and become a person. And if you recall from your reflection assignments, you had to determine for yourself what is human and what is a person. So we're going to look at defining human life. How do we define when human life begins? And there's a couple of views we're going to look at. And we're going to look at primarily the Western view, which is the area that most of us are going to be working in. So we have the Western religious view and the Western secular view. And according to the Western religious view is the idea that divine likeness is what makes life human. So in other words, it's this likeness to God, this being made in the image of God that makes us human. That's what separates us from the animals. And that's how some people choose to define what is human. The Western secular view, as opposed to focusing on God, focuses on the biological or functional sense of what makes a life human. So this is really looking at the specific human cells working together to create this larger being and the DNA that makes us distinct as humans. So if you wanted to think of this in terms of ethical theories, the theories that really come to my mind are religious natural law, which would say that we were created by God in likeness to God. And then secular natural law that says that we were created based on this scientific biological understanding. Now, I do want to note that the two views do not need to be mutually exclusive. You can hold to portions of both views. You can hold that what makes us human is that we are made in the image and likeness of God, and also that our biological makeup further supports this. So you don't have to separate these. Some people do, some people combine parts of them. And I hope you kind of saw how that works when you did the reflective assignment yourself. So then how do we define person? And we talked about this as well, looking at what is a human and what is a person. And again, there's a couple of different views, and some of you may relate to some of these views. The conservative religious view says that there is no distinction between what is a person and what is a human life. So the conservative religious view says that we are a human because we were made in the image and likeness of God, and that is what also makes us a person. However, some more liberal and philosophical views say that what makes us a person is a cluster of traits that allow for the capacity for us to have complex forms of consciousness. So what makes us a person is this ability to think in very complex, abstract ways. A lot of times you'll hear logic and reason when this is described. So then when is ontological status obtained? When does the unborn fetus, the unborn child, when is that child considered a human? When is that child considered a person? And really, this is what is at the root of all reproductive ethical issues and all ethical issues at the beginning of life is how do we define when life starts? Is an unborn entity, is the entity of the unborn fetus a human? Is it a person? Is it both? And at what point does the unborn become a human, a person, or both? So there's two different views. Again, there's immediate hominization and delayed hominization. And immediate hominization says that the unborn is a human from the moment of conception. As soon as conception occurs, as soon as the sperm fertilizes the egg, then that unborn is a human. Delayed hominization says that the unborn does not attain full human status until a certain point in the process of development. And I kind of touched on this on the previous slide, that some people consider that a human life starts. Some people consider it as conception. Some people consider it when there's brain activity. Some people consider when a heartbeat can be found. Some people consider when the age of viability is met. Some people consider when the being is outside of the womb. So there's a bunch of different definitions for delayed hominization. to then is that what rights the unborn has really stem from one's view of ontological status, because we discussed some very general understanding of human rights and rights that all people should have. Well, the rights of the unborn therefore depend on when are they a human. The moral status of the unborn and when they become a human really impacts how many weeks gestation abortion occurs at and how you view abortion that occurs. Some people would say that Plan B is abortion, the pill that's taken within 72 hours of sexual activity to prevent the implantation of the fertilized egg. Some people would say that abortion is okay during the first trimester. Some people say it's not okay at all. And a lot of that depends on how they're defining the ontological status of the unborn. Other moral concerns, what about abortions that save the mother's life? How do we determine whose life has more value and is more worth saving, the unborn or the mother? Some of that comes down to defining who's a human and who's a person. Again, abortion at any stage, some people will say, especially if they believe in immediate hominization, is wrong. And then we also consider this age of viability. And age of viability tends to fluctuate. When I was in nursing school, age of viability was more like 26 weeks. And now it's down to 23, 24, because there's so many other technologies that we can use to promote viability and help these infants, once they are born, live outside of the womb. So the age of viability, with the fluctuation of that, can really bring forth more ethical dilemmas in and of itself. So, when does life begin? So, we talked about when is someone a human, when is someone a person, when does life begin? And I'm going to provide some other definitions for you. There's the genetic view, which is immediate hominization. Life begins at fertilization. There is the embryological view that says that life begins at day 12. So the reason, and this isn't day 12 after living outside the mother's womb, this is day 12 as far as the trimesters and the fertilization. So 12 days after fertilization. And the reason some people say this is because up until day 12, the egg can split and you can have identical twins. So people say that while that egg still has the ability to split into identical twins, you can't say that life begins because you don't know, is this going to be one life or multiple lives? The neurological view is based on brain development. So this really looks at how fully developed is the brain. Are we going to look at when we first see electrical activity? Are we going to look at the age of viability? Or are we going to look at when the brain is further developed? And then there's the ecological view that says that life begins once the unborn fetus would be able to exist separate from the mother's biological environment. So the age of viability, when the fetus can exist outside of the womb. So I know this kind of sounds like a lot of similar information presented in different ways. And really that's exactly what it is. But the information may be presented to you in a professional setting in any of these ways. So I want you to have heard terms such as ontological status, immediate hominization, delayed hominization, and the different views of when life begins. So, another ethical issue that we have to discuss at the beginning of life is assisted reproduction. And I want to be very clear here. When I talk about assisted reproduction, I'm talking about assisted reproductive technology, or ART. ART is very different than infertility. You may know somebody, or you yourself may have suffered from infertility, and you may have gone to a fertility clinic and worked with somebody who helped you track your cycles and helped you, maybe you had to take medication so that you could ovulate, so that you would be able to conceive a baby. That is not what we are talking about with assisted reproductive technology, or ART. ART is more specific than that, and it's more invasive than a lot of infertility treatment. ART is the surgical removal of eggs from a woman's ovaries, combining them with sperm in the laboratory, and then returning them to the woman's uterus. So I just want you to be aware that that is what we are talking about. So what is the ethical debate surrounding art or assisted reproductive technology? And the debate really comes down to, at what level, if any, do you approve of this? Some individuals oppose all forms of assisted reproductive technology, and they say that when a child is created through this technology, children become viewed as commodities, something you can go and purchase and buy, such as a car. And they say that art reinforces the view that all women, whether they're infertile or not, should strive to become mothers. So some of these individuals say that art is saying that the only value of a woman is the ability to reproduce, and that should be the goal of all women. There are those then that are completely approving of art, and they base it under principalism and specifically autonomy, saying that the decision should be left to the individuals involved, and that art is a form of procreative liberty, privacy, and again, autonomy is the matter of purpose. So those opposing art, maybe those who have natural law as their ethical background, saying what comes naturally, and art is not natural. It's using technology to perform what the body is not able to fulfill naturally. Some individuals will approve art with restrictions. And as I said about art being when the body can't conceive a baby naturally, these individuals are usually approving art in those cases, but are not approving art when it is being used for specific selection. And we'll get to that on the next slide, but selecting embryos for specific traits. Additionally, those who approve art with restrictions also say that they question the resources and money that are spent on art when there are many children who lack a stable home environment. And they say, if somebody wants to have a child, why are we putting all of this effort into someone who cannot naturally have a child to give them a child when there are plenty of children available who need homes? And different people have different views on that. Some people have a view very much based on a child is a child is a child. Some people have views based on they want a child that is from their lineage. And we'll talk about that a little bit more later on. The general positions of these three ethical angle groups can be sorted out according to whether they are based on principle or whether they are empirical. Deontological arguments are going to be very principle-based. So remember, deontology, it's your duty. So those who hold to deontological standards primarily and are pro-art are going to discuss autonomy, and that's how they're going to argue for art, is based on this idea of autonomy, because if you remember, Kantian ethics is heavily grounded in autonomy. Those who are anti-art are going to discuss why it's morally objectionable, because again, deontological beliefs are grounded in your duty to do what is morally right. So they're going to say things such as the children as commodities. Utilitarian arguments, on the other hand, are very empirically based. So they're going to be looking at what are the outcomes of this. So those that are for art are going to talk about the value of the outcomes and the benefits to those involved in the process, and the benefits of being able to allow this woman to have and conceive a child. Those who are against art are going to consider what circumstances are objectionable, and that what are the outcomes of, if we are creating a child, are we making the child a commodity? Are we doing the greatest good for all of these other children that need a loving home? So you can kind of see how certain ethical theories, deontology and utilitarianism, could be used to argue either view. However, you can see how natural law can also be used, but is more likely going to be used to oppose art because it's not natural. And so this is what I want you to be thinking of as you're trying to make some of these connections and consider, what do you believe based on your worldview, and also how does that align with different ethical theories? So we're getting more into what you started in the reflection assignment. Perhaps the most powerful principle-based arguments in the art debate are those that appeal to rights. Those who are proponents or acceptive of art support the right to procreative liberty. In other words, these individuals say that all humans have a right to choose to have or not to have children. This right to have or not have children is a negative personal right. This means that no moral duty is violated by choosing to procreate, and no individuals have a duty to interfere with another's choice of whether to procreate or not procreate. And it would seem then that the freedom to procreate non-coitally should also be recognized, since this may be the only way for a person to reproduce. When we consider the right to procreative liberty, aside from the deontological argument, other applicable ethical theories and principles that arise is the respect for individual privacy and autonomy in making choices among the full array of available reproductive technology. The other right that is often argued by those who are against art is the right to life. For any view that associates full ontological status with fertilization, pre-embryos are therefore defined as human beings, and art inevitably then raises concerns about the fetus's right to life. In many cases, when art is performed, extra embryos that are not re-implanted into a woman's body are then frozen for an unknown period of time. Those who are opposed to art state that freezing the embryos is not ethical because it constitutes an offense against the respect due to human beings by exposing them to grave risks of death or harm to their physical integrity and depriving them, at least temporarily, of maternal shelter and gestation, thus placing them in a situation in which further offenses and manipulation is possible. Therefore, those who oppose freezing excess embryos believe that all pre-implantation embryos should be transferred to a womb. When we consider art and we consider the right to life, beyond the deontological ethical view, the other applicable ethical theories and principles here would be the divine command theory. And divine command theory would hold to this belief in immediate hominization and that a pre-embryo is a human from the moment of fertilization. Additionally, the principle of equality, which we recently talked about, is a moral principle that is often used to support the right to life. On the assumption that pre-embryos are human beings, it is argued that it is wrong to intentionally permit their loss or destruction, as it would be with regard to any other human. Therefore, if an embryo, a pre-embryo, is a human, it has the equal right to life that any other human being has. We will now look at the empirically based or utilitarian based arguments surrounding art. The empirical arguments around assisted reproductive technology generally relate to their near and long-term impact on how we view reproduction, lineage, and the meaning of family. Another concern involves the well-being of the offspring created through art. Driving opinions in all of these areas are strong feelings about the commerce of reproduction. When we look at the commerce of reproduction, donors of both eggs and sperm are compensated for their donations. Egg donors receive between $5,000 and $10,000 on average per donated egg, and sperm donors receive between $50 and $200 per donation. These numbers vary widely based on the area in which the donation occurs, as well as if the donor is considered to be of very good health and has qualities that would be very desirable from somebody who is looking for a donation. Things such as IQ level, again, health, things such as maybe specific hair, eye colors. Some legal considerations regarding the commerce of reproduction are that sperm and egg donors relinquish all parental rights and responsibility of the time of donation. Therefore, they are nothing more than a donor. They do not have a role moving forward in the child's life. They may choose to share some of their background information with the family that is going to be receiving the egg or the sperm. And in most areas, once the child reaches a legal age, the child will have access to information regarding their biological donor parent. However, this parent has no legal right or responsibility for the child. When we look at the commerce of reproduction, we're going to look at those who support art and those who are against art. Those who are against art say that just because of the commerce side of art, children become commodities who are bred by technology for certain traits. Many people that are going to a donor are looking for certain traits, whether they're looking for to have a donor of the same race as them, or whether they want to have a child that has a greater potential to be musically inclined or be mathematically inclined or have a certain hair or eye color or physical traits. And those who are against art also say that another concern is the long-term physical and psychological risk of egg extraction. While sperm donation is rather safe and simple process, egg extraction is an invasive procedure that occurs with the woman. And questions become, how informed is this woman when she is donating her eggs? Is this truly informed consent, or is the woman to some degree being coerced by this large sum of money that she can get from donating her eggs? What type of long-term psychological effect might this have when a woman looks back and considers the life that she gave, that she has no legal obligation to knowing what happened with that life? Those who are proponents of art say that people who are selling their eggs and sperm are synonymous with somebody who is giving a blood donation or somebody who is given an organ donation, saying that those who donate are both generous and compassionate. And they asked that if the money that is being exchanged for this service is really even relevant, citing things such as plasma donation, where people are paid to donate their plasma. They also say that yes, there is a cost involved with art, and that people who are going to conceive a child through art pay this cost and are aware of this cost. However, can we really say that's any different than other forms of family planning? Most people plan ahead to have a child, and when they do that, they begin to save money, they put money aside, they use money differently. And should family planning that is related to art be different than family planning such as planning for your child's college education, putting aside money for diapers, etc.? The next area that brings up question is the question of lineage, because art allows parenthood for single couples, same-sex couples, infertile individuals and couples, and even taking sperm or eggs from the deceased so that the living can have a child conceived with someone who is deceased. And underlying a lot of these discussions of lineage would actually be the story from the Bible of Abraham and Sarah. When Sarah cannot bear an heir, she tells Abraham to consort with her maid, and that perhaps he shall build up through her. Following custom, Abraham is to produce an heir with another woman. In this case, it's the Egyptian maidservant Hagar. He and Sarah then are to adopt the child of their own. However, the relationship between Sarah and Hagar did not succeed. In a rage, Sarah drove off the mother Hagar and her child Ishmael. Still, an angel of God who promised that Ishmael would father a nation rescued the outcasts. And this leaves many Christians questioning, what should we make of this biblical tale? How do we interpret this story? What is God trying to tell us? And some say that this is a cautionary tale, that this story is warning about the negative outcomes that can come from surrogacy. Others say that the Bible can be read as holding a modern, nuanced view of surrogates, and that as women looking after the baby for the parents rather than giving up the baby. So even the Bible, depending on how you interpret it, can be very unclear about art through surrogacy. Those who are opposed to art would say that the question of lineage is that the clarity of lineage is threatened here by introducing third parties into the transmission of life, and therefore that art is synonymous with incest and adultery because of this breaking up the lineage. Those who are proponents of art say that art makes fertility possible for those who are otherwise infertile, and that art is not immoral in the same way that adopting a child who would not have the same background and lineage as you is not immoral, because there is no sexual intercourse involved, and sexual intercourse is what would make art immoral, and they would say that therefore the intercourse between Abraham and Hagar is what made art immoral in that case, because in biblical times it was not Sarah's egg, it was Hagar's egg to make Ishmael. Finally, the question of the meaning of family comes up. Art makes alternative families possible. Naturally, a child can only be born between a man and a woman. Art allows for same-sex parents to have children. Art allows, again, as we discussed, infertile parents to have children. Art allows for people that have had surgery or cancer or are single individuals to have children. Those who are against art say that art threatens the traditional understanding of family and questions what are the best interests of children and what are the long-term outcomes for these children, stating things such as children born of art have been found to have higher rates of cleft palates, and children born from art, there's a greater chance of having twins or triplets, having multiple births, and the long-term effects, positive or negative, this may have on the children. And because there is not a long-term spell of research about these effects of children into adulthood. And then concerns with children whose parents through art wait till after retirement to have a child, and then the parents are dying while the child is at a young age. Does that have an impact? Those who are pro-art say that based on the data that is available, there is no basis for a higher rate of psychological or social problems from children born through art than children who are conceived naturally. They say that the best interests of the child, just as we cannot guarantee that a young parent will live for a long time, we can't guarantee in art some of these factors that might impact the child. And those who are pro-art say that art recognizes the value of all family structures and from an equity standpoint views all family structures as equitable. So now we're going to kind of bring all of this information together so that we can talk about art and the right of life on the next slide. We're now going to shift the focus of the argument just slightly to look at art in light of respect for life as opposed to art related to a right to life. Some opposition to art is based on respect for human life, as opposed to the belief that the pre-embryo has a right to life akin to a full human being. Therefore, if we look at the right to life from a narrow view, only what occurs naturally in reproduction can be deliberately mimicked. Therefore, sometimes art is permissible because a like or similar loss occurs routinely in the natural reproduction purposes and process. Furthermore, no disrespect is intended or practiced by the mere fact that several eggs are removed to increase the chance of success. Importantly, assuming nothing further is done with the implanted embryos, There is nothing disrespectful going on. The demise of these unimplanted embryos would be analogous to the loss of numerous embryos wasted in the normal in vivo attempts to naturally generate a child. Therefore, art is permissible if nothing is done to the embryos and they are allowed to analogously be lost. The remaining embryos, therefore, for art to be acceptable, must not be transferred for adoption into another infertile woman, should not be used for investigative or research purposes, should not be actively killed, or should not be perpetuated in vitro ultimately, perhaps into viable full-term babies. All of these options disrespect life because they are treating pre-embryos as things or stuff. Therefore, simply stated, under the narrow view of respect for life, the only acceptable form of art is to treat infertility. A broader view of respect for art looks at this idea that biological research related to art for all purposes supports a love and compassion for new life as well as for existing life, and that the scientific view of human embryos donated for research is different than how scientists view other research subjects. Specifically, these pre-embryos are viewed as special. They are not used for trivial or scientifically worthless research. In this broader view of respect for life, art is a form of respect for life in and of itself through the context of allowing for a liberal reproductive choice. We will conclude our discussion of art by talking about how art relates to gender liberation and self-determination for women, as well as the application of using art for the purpose of surrogacy. There are some who believe that art promotes female liberation and self-determination. For these individuals, art is viewed as a form of privacy, autonomy, and reproductive rights. Art allows a woman to decide the circumstances under which she chooses to become a mother. The basic feminist contention is that, like men, women have, or should have, a right to use their bodies as they autonomously choose, reproductively speaking. Thus, if women have a right to have and rear children, and if art is the only way a woman can practice this right, then, as a principle of procreative equality, women should have access to art. Furthermore, some individuals will take this stance on the application of art to surrogacy and say that a woman should have the right and access to choose to bear a child, be inseminated through art, but then not rear the child, give the child to another family to be raised. Those who are against art and are using gender liberation and self-determination for their stance say that art marginalizes a woman's role in the birth process and is another way that men continually historically attempt to dominate women, and that this is a form of controlling a woman's reproductive functions. Furthermore, those opposed to art apply this to surrogacy and say that surrogacy is a form of turning motherhood into simply making women breeding stock. We're going to continue this lecture by shifting our focus from specifically ART to prenatal testing. And we're going to talk about embryo screening, which is often seen and used in conjunction with ART, which is why you needed to have a solid foundational understanding of ART before discussing the ethical implications of embryo screening. Embryo screening really began as pre-implantation genetic diagnosis, PGD. And the idea behind PGD was to provide conclusive information about the genetic health of the embryo before it was implanted into the uterus. And this was initially done because ART was very expensive, and it still is, and it's not covered by most insurances. And so what PGD did was ruled out that an embryo was going to be implanted in the uterus that would not be viable. So it looked out for certain genetic diseases and disorders that either would not allow the infant to be viable outside of the womb, or the infant would die at a very young age. So such diseases such as Tay-Sachs. Pre-PGD was also used to help create compatible donors that would be called savior siblings. So if you had a child that, say, had leukemia and needed a bone marrow transplant, you could create a child using ART as a sibling that you could specifically look for that they would be genetically compatible to be the living child's donor of that bone marrow. Or their stem cells could be used at birth to serve the needs of their living sibling or their cord blood at birth. And PGD also could be used to create stem cells for other therapeutic uses, because the research has shown that the stem cells created from pre-implantation genetics, so create the stem cells that are developed before this child is born, have a lot more ability to grow and develop differently than stem cells that you or I have. If you take stem cells from a certain organ in an adult's body, those cells are only going to form that organ. Where you can take stem cells from the unborn, and those stem cells have the greater ability to differentiate. And Some of you may be seeing some of the ethical considerations already, and I do hope as I'm going through, your minds start to think, what is good about this, but what would make this an ethical dilemma? What might not be good about this? So one of the big issues is embryo creation and destruction. So how should the disposal of these unacceptable embryos be viewed? So if there is an embryo and it is tested and it shows that this embryo would not develop a child that would be viable outside of the womb, or a child with Tay-Sachs that would die at a very young age, how do we dispose of this embryo? And that really comes down to your idea of, okay, when does human life start? When does personhood start? Are we disposing of a person, or are we disposing of a ball of cells? And I don't mean to sound uncaring when I say that, but I don't know any other way to describe it to make the comparison. And I'm not saying one is right or the other is right, but it's basically, is this a person, or is this dividing cells in DNA only without a person yet? We also worry about, if we're creating and destroying embryos, is this a slippery slope for manufacturing babies simply for spare parts? And we talked about savior siblings and how some of these savior siblings could grow up themselves to live very normal, viable lives, but save the life of their sibling. But then, are we creating a child simply to take a part of that child for another child, and that was the only purpose we had for that child? Then where do we limit the use of embryo screening? Should it be used for just medical purposes, or should it be used for social purposes such as sex selection? So what's permissible? What makes it permissible? And then trait selection. So there's the principal considerations, the deontological considerations. What is your duty? The religious view says that selecting of traits for the child is against God's will, because all children are a gift from God, exactly how they are created. So if we're going in and looking for chromosomes to see, is the child, for example, going to have Down syndrome, and we don't want that, then there's this view of, are we playing God? And that would be morally wrong, because we would be using those, especially if we viewed this as a human, as a person, we're using them as a means to an end and not an end. We're using them as a means to get a child that has or does not have certain traits. The secular deontological view would say that trait selection is unnatural. So we're not discussing God, we're not discussing a higher deity, but we're saying it's just not natural. So that would be more like secular natural law, and also deontology. What is our duty, and what principles should we follow, and what is morally right? Well, what is morally right would be natural, and this is not natural. The empirical considerations, which tend to be utilitarian in nature, are looking at what's the outcomes and what's the consequences. And some people will bring up that not all genetically defective fertilized eggs will generate a disorder or a disease. And you see this a lot with recessive traits, where both parents would have had to have the gene for the trait to develop. And also, even though somebody is genetically predisposed to something, doesn't mean it's going to generate an outcome. And a really simple example I can give you is myself. And I got allergy tested because I have allergies to all kinds of things. And my allergy testing actually says that I should be highly allergic to dogs. And any of you who know me or have been to my office and have seen pictures of my dog know that I have a German Shepherd with fairly long hair. I've had dogs my entire life. The allergy never expressed itself. Cats are a different story. But if you look at my genetics, I should have allergies to dogs, but it didn't express itself. That's a little bit less extreme than this, but to just give you an understanding of what I mean here. And then also a utilitarian view would be, what if we discard an embryo now because it has this potential for this disease or disorder, but then there becomes a cure during what would be the lifetime of that individual. So I think of something, not that there's technically a cure for breast cancer, but I think of somebody who maybe has a BRCA1 or BRCA2 gene, and that embryo was discarded 20, 30 years ago because at that time breast cancer was pretty much a death sentence. Well, now with all the screening available, many women who have breast cancer, their cancer is caught in stage 0, and treatment can be done that they can live a very normal, healthy life and not have significant long-term effects. And so this question is, we're looking at today's technology at what makes this a very significant debilitating disease. And again, some people may go back to this religious natural law view and say, are we playing God instead of letting what happens naturally come naturally, and maybe there would be a cure down the road? So some other things to think about here. Next is the stem cell debate, and I briefly touched on stem cells on the prior slide, but the stem cell debate is a huge debate that you are going to hear about when you discuss ethical issues at the beginning of life. And I was in high school at the time when Dolly the sheep was cloned. Some of you may not have even heard of Dolly the sheep, but that was a big deal, cloning sheep. And so it stems back to this idea of stem cell. And when I was in high school, it was a very hot topic. You don't hear as much about stem cell research as a hot topic as you did before. And I think some of that is there's a lot more education on embryonic versus non-embryonic stem cells. And really, the stem cell ethical debate is regarding embryonic stem cells. So I do want to provide you with a little bit of background and knowledge in case you do hear stem cell debate questions, that you know what to ask task and response. Is it embryonic? Is it non-embryonic stem cells? So, embryonic stem cells exist only in days-old human embryos. So, embryos very, very briefly after fertilization. And the thing that people want for research with embryonic stem cells is they have the potential to become any type of human cell. And I briefly mentioned that on the prior slide. Non-embryonic stem cells, or what are called adult stem cells, exist in fetal and adult tissue. So when you hear adult stem cell, that doesn't necessarily just mean adults like you and I. It means any fetus that is developed beyond a few days. So the adult stem cells can renew themselves to yield a limited number of cell types of tissue or organ. So they can only renew themselves so many times, and they're going to be related to a specific tissue or organ. So in other words, if you have liver stem cells, you're going to get liver cells. You're not going to get brain cells, where if you had embryonic cells, you may get liver, you may get brain. The differentiation, you're going to hear this term. Differentiation is the process during which unspecialized stem cells become specialized. So differentiation is when these stem cells become a specific type of human cell. Lines, then, is a mass of stem cells with the same genetic code that have been extracted to prevent differentiation. So that they don't become a specialized form of cell. They're extracted before they specialize. Cloning is another term you need to be aware of, and cloning is manipulating a cell so that an identical copy can be produced from it. So So this leads us then to consider, how are we going to obtain stem cells? We obtain stem cells, the embryonic stem cells, from pre-implantation or what are called spare embryos. So embryos that are left over from ART. And these embryos are often stored somewhere. And some people store their unused embryos from the artificial reproductive technology. They don't know what to do with them. They don't want them destroyed, so they store them. And these stored embryos can then be used for stems to obtain stem cells. Created embryos can actually be created by stimulating an unfertilized egg to create embryos that are simply for the purpose of research. So this brings us to some other ethical considerations. What is the material being used? What is the source of it? So are we using created embryos? Are we using pre-implantation embryos? Are we using spare embryos? Where did it come from? Did it come from somebody creating it in a lab? Did it come from embryos that were discarded because they failed pre-implementation testing? Did it come from spare embryos that somebody has being stored that they no longer need because they were able to have a healthy child and they decided that they were done having children but had extra embryos? And then what research is going to happen? What are you using these stem cells for? And those are all questions that are going to may influence someone's interpretation of whether this is an ethical process or not. So really, the ethical debate has to do with things such as how is the embryo being destroyed, and is there a moral difference between using spare embryos or pre-implementation embryos versus using a created embryo for research? Is there any difference in the use of these? And those become the questions that need to be answered. You will find that one of your assigned readings in this week's module is a PDF document listing 41 different ways to make a baby. Before I really started digging into ethics and reproductive ethics specifically, I had no idea how many different ways there actually were to create a child. As we bring this lecture to a conclusion, the bottom line is that we live in a time in history when there exists many reproductive options. Therefore, as healthcare providers, as Christians, and as individuals, we need to be able to evaluate the options that are available. Each of us must be able to determine and defend for ourselves within the context of our worldview which of these options we deem ethical and which we deem unethical. As you may have already started to realize, there really are inadequate approaches for ethically assessing reproductive technology. In general, the approaches are either very narrow or very broad. The conservative approach is that biological integrity needs to be preserved without artificial interference. Therefore, no form of artificial reproductive technology would be deemed ethical. On the other hand, the liberal approach is that private acts of autonomous individuals regarding their production is a form of procreative liberty and is therefore always ethical. You may be thinking this sounds like the discussion way back at the beginning of the lecture, and you are correct. We have come full circle. The problem often becomes that while the conservative or liberal view of reproductive technology sounds fitting when reading a textbook, the right choice is not so clear when you start to apply these situations to real people. Suddenly, these dilemmas are not case studies, but rather they're involving a person with a history, with a story, a person who has desires and wants and needs, a person who brings to their table their own beliefs, their own feelings, what they see, and how they view things. As some of you pointed out in your reflection assignment synthesis, humans are very complex. Therefore, developing a normative or universal stance on an ethical issue can be very challenging. As we transition from the lecture to the discussion board this week, I want to leave you with one final consideration. I want to challenge you, each and every one of you, to keep your minds open, at least enough to be willing to hear and listen objectively to the views different from your own. Thank you for your time, and I look forward to seeing you in the discussion board.